anytime you brought evaluation up, it was really like a four-letter word. It was one of those things that people didn't want to hear, didn't want to talk about. And it was really around the culture, and people were used to being evaluated. And if we were evaluating, we were looking at and evaluating them as individuals and not necessarily evaluating the program or the implementation. And so people had that connection of being evaluated, thinking that that brought us to the other F word, which is failure. And so they didn't want to know if we were failing or not. And I think as an implementation scientist and a patient partnered implementation scientist, we've learned that failure is important and quality improvement is about failing, learning what works, what doesn't work. And so our next big challenge was learning to normalize failure and really having a safe place to fail, to learn how we're going to fail fast so that these cycles are faster. And so we have built in some of the infrastructure and the support around failure. We have a community of practice around failure. And that failure now extends into it seems like a little weird thing to have a community practice around failure, but it gives people the opportunity to talk about the things that they're really struggling with.